Throughout the pandemic, healthcare providers have encouraged people to continue going to the doctor for preventative care. And now North Alabama oncologists say a recent drop in cancer diagnoses could lead to a spike later this year. WAAY 31's Alexis Scott spoke with a Huntsville doctor about what he's seeing among patients.
At the Clearview Cancer Institute, doctors say they've seen fewer people getting diagnosed with different cancers during the coronavirus pandemic. They say it's because fewer people are actually going to their appointments. And staff here say they want you to know they're taking every precaution there is to make sure that you feel comfortable seeing your doctor.
We did see that there were a lot less diagnoses kind of in the April-May period, and we think that may have been a consequence, unfortunately, of less screening modalities.
Dr. John Richard Nicholson works at the Clearview Cancer Institute. He told me their data shows a nearly 40% decrease in cancer diagnoses this April compared to last April. He says he's worried about what that means in the long term. And Dr. Nicholson said April's drop could lead to more people having an increased risk for additional cancers. He said others run the risk of a delayed diagnosis if they reschedule an appointment. And Dr. Nicholson told me at CCI they're doing all they can to keep you safe even before you walk in the door.
The 24 or so hours before, making sure patients aren't particularly actively symptomatic, so that way if they've been tested, with swabs for COVID-19 exposure.
And that's not all. They're temperature checking everyone who walks through the front door, asking screening questions, emphasizing the use of masks and using plexiglass and social distancing inside. Since May, he says they've seen a slow and steady increase in the amount of people getting their cancer screenings, and that's something Dr. Nichols says he hopes to see continue.
Even if something's caught much earlier, that's always going to be almost always in the patient's favor versus later diagnoses if they're avoiding screening measures. So we do want to emphasize we feel it's safe for patients to re-implement their screening measures.
Reporting in Huntsville, Alexis Scott, WAAY 31 News.
Clearview Cancer Institute also handles chemotherapy treatment for cancer patients. The facility said they're following the same guidelines as they do for other patients, but are also cleaning daily. They said if patients have any questions, they can always call their doctors.